Hi, my name is Caitlyn Cunningham. I'm a master's student at SUNY ESF, and I'll be presenting today on my project on fate and transport of PPCPs or pharmaceutical and personal care products. So, personal care products and pharmaceuticals or PPCPs are a diverse group of microcontaminants that include prescription medicine like antibiotics, over-the-counter medicine like ibuprofen, hormones, detergents, veterinary medicine, some select pesticides, think like off-branded products that are for personal use, cosmetic components, and even chemical food byproducts like caffeine. Given their diverse use cases, there are many potential sources of PPCPs. Many are associated with human waste streams such as septic systems or wastewater effluent, as many of our current waste treatment methods are not designed to mitigate these chemicals. When you take medicine, only a small portion is available to the body. The rest is discharged to the environment. The same is true for veterinary medicine. For a given livestock operation, many of the medications provided to the animals in question may be found within their waste, which may move via runoff to larger water bodies from there, or be spread over a larger area as fertilizer before making their way through the watershed. Given these contaminants are highly bioactive, they can have an impact even at low concentrations. Some may bioaccumulate, and not all are easily removed by standard water treatment processes. They may also make their way out of the watershed and into larger systems, spreading far from their original source. The objective of this study is to create and apply an index that assesses risk associated with PCPs based on physiochemical parameters that evaluate a compound's environmental persistence, bioaccumulation risk, transport mechanisms, and toxicity in order to understand how this diverse group of contaminants moves and accumulates within the environment. I started by pulling over 140 compounds from relevant literature on environmental occurrence of PPCPs. From that large list, I selected 56 compounds that represent a diverse set of use cases and PPCP types in an effort to capture both human and veterinary-based products, as well as diverse chemical properties. I used the EPA's EpiSuite software to pull experimental and modeled characteristics of these compounds, including molecular weight, KOC, KOW, and aquatic ultimate biodegradation timeframes. In addition, I used their SMILES codes to assign functional group identification to each compound. These properties were used to generate an index to assess transport and toxicity risk. I assigned a risk rating of 1 to 3 to each functional group based on LD or LC50s of simple compounds of that functional group. For example, benzene was used for aromatic rings. Each functional group within a given compound was scored from 1 to 3, but because each compound had a different number of functional groups, this resulted in varying maximum score values for this parameter. Because of this, I normalized the score by dividing by molecular weight, assuming larger molecules generally have more functional groups, and rescored the ratios that resulted in the scale from 1 to 3. The rest of the parameters were scored from 1 to 3 based on presumed risk. KOW was used to assess bioaccumulation, where a high KOW indicated a high bioaccumulation risk. KOC was used to assess transport mechanisms, where high carbon affinity was moderate risk and high water affinity was considered high risk. Longer persistence was assumed to mean higher risk as well. Molecular size was considered high risk at either extreme. Score breaks were determined by Jenks natural breaks. As you can see, aspirin and acetaminophen scored the highest. However, I'd like to note that their persistence is quite low. For this reasons, I would say the next group of compounds, especially triclosan, sertraline, oxycodone, norafloxacin, galoxolide, fluoxetine, ethinyl estradiol, clostantel, and amitriptyline are identified as high risk by this index. Note that these are characterized by high persistence, moderate to high toxicity, moderate to high bioaccumulation risk, and moderate to high transport risk. The compounds that scored lowest on this index are generally characterized by low persistence and low bioaccumulation risk. Note that erythromycin is somewhat of an exception to this trend, as it has both long persistence and high bioaccumulation risk. Future work for this project includes assessment of this index, which I plan to do in 3 ways. 1, by comparing to environmental concentrations, assuming higher concentrations indicate higher risk, comparing to number of environmental detections, assuming more detections means higher risk, and assuming comparing to spatial distribution, assuming a more diffuse distribution means a higher risk. Environmental data for this phase may be sourced from literature, but I'm also planning on sampling Owasco Lake tributaries this field season. This is my poster for the meeting. I look forward to discussing my work further with you there. Thank you.